Good evening, everybody. Thank you all so much for joining us. We're going to get started at about 5 minutes after. My name is Lee Johnson. I am one of the coordinators at NYU Langone with the Office of Science and Research. I will be your moderator for this evening. We're going to give everybody a couple more minutes to join us, and then we'll start on our introductions. All right, we'll go again and get started. Again, good evening. My name is Lee Johnson. I am one of the research coordinators at NYU Langone, and I will be hosting this evening's webinar. We'll be hosting a Q&A on COVID-19 and the vaccine in conjunction with the senior staff at the Metropolitan College of New York. Joining us this evening, we have David Hahn, Joanne Pasaro, Joseph Ravenel, Dominic Boyce, and Aisha Langford. Our staff also includes myself, Lee Johnson, Sonia Cifuentes, and Victoria Foster. We are very grateful for you all to join us this evening. We want to thank all of the members involved who are listed on the bottom of your screen. Today, we will be having this webinar. The Zoom call will be in a webinar format, so no one will have their video or audio on. So we won't judge you if you have on pajamas, it's okay. We will be hearing from industry leaders, people who have been involved directly with the vaccine process. You will have all of your questions answered, so feel free to insert them into the Q&A session. This video is being recorded, so if you'd like to share at a later date, it will be available on both the NYU Langone side as well as the MCNY side on Facebook. So I'm going to go ahead, we're going to get started. I'm going to introduce our first speaker, who will be President Pasaro. And I will give you a brief introduction on her many accomplishments. Joanne Pasaro is the president of MCNY. She's a cultural anthropologist who holds a BA and PhD degrees from Duke University. Her academic research focuses on social inequality and ideologies of oppression. Over the past 20 years, Pasaro served in leadership positions at a number of colleges and universities. She is currently a member of the Board of Trustees of the Commission on Independent Colleges and Universities. Pasaro returned home in 2018 to serve as president of MCNY. The college's visions and goals align closely with her own. MCNY was founded in 1964 to bridge the gap between inequality and opportunity for adult students. In its unique curriculum, purpose-centered education, it closely integrates classroom studies with work experience and empowers students to create positive change in their organizations and communities. Dr. Pasaro is honored to participate in the work of expanding opportunity and equity throughout the New York region. Joanne Pasaro.
Thank you so much, Lee. That's more than anyone needed to know about me. I'd like to thank you, Lee. I'd like to thank Sonia Cifuentes, Victoria Foster for helping us organize this. And then, of course, Doctors Langford and Ravenel for taking the time to join us, and our very own Dominic Boyce. This is a very, very important webinar for us. And David Hahn is here on behalf of the Office of Academic Affairs. And really, our commitment to getting the information that our students and community needs runs deep. Metropolitan College of New York serves a population of primarily Black and Latinx students. Many of our community members, including some of our staff members, have expressed concerns about the vaccine and have expressed hesitancy for a variety of complicated reasons that you all understand better than I. They're historical, they're cultural. We see this as an issue for us of race equity to make sure that we, Metropolitan College of New York, are getting our community information they need that could help them navigate this important decision by trusted medical professionals in their communities. So this webinar is so important to us. I can't thank you all enough for taking your time to have organized it and for joining us tonight. This is a very, very important educational opportunity for our community, and we're very grateful that you're hosting a live webinar so that people can have their questions answered. Thank you all very, very much.
You're very welcome. It is our pleasure. So we're going to go ahead and get into it. The first person who we're going to have speaking this evening is Dominic Boyce. Bear with me because this man has a very extensive background, and that is a good thing. So Dominic Boyce is a native New Yorker, health advocate, dedicated husband and father, community volunteer, and is heavily involved in organizations such as the NAACP, the Double Discovery Center at Columbia University, the Impact Repertory Theater, American Cancer Society, Akira Center, and the Mailman School of Public Health at Columbia University. Since 2011, Dominic has served as a volunteer manager and coach as well on a various number of sports teams for small little leaguers. In 2011, Dominic and his wife established an annual scholarship at the Double Discovery Center, a middle and high school program for first-generation college-bound students. Dominic is a member and leader amongst many nationally recognized organizations as well, such as the Omega Psi Phi Fraternity, the Omega Trailblazers Harlem Little League team. He also serves as the second district representative to the International Fatherhood and Mentoring Initiative. Amongst these organizations, he also volunteers, was appointed as the health chair of the Mid-Manhattan branch of the NAACP. Professionally, Dominic works as the director of health and hospitals in Harlem. Additionally, he's the adjunct professor of public administration at the Graduate School of Management at MCNY, New York. He's currently working at the Vaccine Center at Harlem Hospital, focusing on community access, and is a graduate of both Brown University and Columbia University. Dr. Dominic Boyce.
Good evening, everyone. Can you hear me?
We can.
I want to say thank you for all our esteemed panelists who will join us, as well as our distinguished leadership from Metropolitan College of New York, to President Pasaro, to Dean David Hahn, And to all those students and faculty members who are joining us on this call, I thank you for this opportunity so that we can engage our community at Metropolitan College with subject matter experts, as we face this third wave of a pandemic here in New York City and throughout the world. Again, I'm Dominic Boyce. I'm an adjunct faculty member here for over 16 years, and I work professionally at Health and Hospitals Corporation. I've been involved with the COVID command since the very beginning. And in the second wave, I was able to help set up vaccination centers across New York City, both with the Health and Hospital Corporation, as well as with the NAACP, working in partnership with the Department of Health and Mental Hygiene. So I thank you for that long introduction, but I also want to thank, NYU Langone for partnering with Metropolitan College to provide this needed information as, again, we approach the third wave. And so we're honored today to have two subject matter experts with us. One is Dr. Aisha Langford, who's a behavioral scientist and assistant professor of population health at NYU Langone Health. Our second esteemed panelist is Dr. Joseph E. Ravenel, who's a board certified internist and clinical hypertension specialist with a strong track record in community-based programs, as well as he's the Associate Dean for Diversity Affairs and Inclusion at NYU Langone Health. So again, I thank you guys for joining us on this call. It's going to be a great conversation, and we hope to engage you during this hour. And again, we're going to start now. We're going to dive right into the issues at hand. Here in New York City, 2 weeks ago, our COVID positivity rate was 0.3%. And as of this week, it's over 2%. So we're seeing this particular increase in COVID positivity rate, and it could be directly attributed to the Delta variant. And so as we move forward, I'm going to turn it over to our first panelist, Dr. Ashford, so we can talk about vaccine hesitancy as we enter this third wave that's being led by the Delta variant. So I'll turn over to Dr. Langford at this point. Thank you.
Okay, great. Lee, do you have the slides? Okay, so I'm Aisha Langford. Just a few, disclaimers or things I should note. I have 2 degrees in public health. So I have been a strong vaccine advocate for many, many years, and I'm up to date on all the vaccines I'm supposed to get. So I'm very happy that we're having this conversation. And I'm also in Pfizer's phase 1 clinical trial for the COVID-19 vaccine. So I was one of the first people, in the world to get the COVID-19 vaccine through Pfizer. So I actually got both of my shots in July of 2020, and I chose to get an optional booster through the clinical trial in March of 2021. And I say all of that because some of my family members and friends thought I was crazy for doing it. One of my colleagues that works in the community said, what if you drop dead getting that experimental vaccine? And as you can see, I have not dropped dead. I'm very healthy, I'm well, and I'm really excited that we're having this conversation. So if you want to talk about that, we can talk about that as well. So just briefly, the COVID-19 vaccines, one of the things that we hear about quite often is how did they get developed so quickly? And in short, one of the reasons is because we had literally decades of good science to build upon. Probably for the first time in history, we had countries around the world working together, and the science was properly funded. So when I think about my own personal life and also in research, a lot of times things move slowly because I don't have the money and I don't have the right people. So in this case, we had good science, enough money, and the right people working together in real time to get this vaccine or these vaccines to us. The Moderna and Pfizer vaccines are what we call mRNA vaccines. They're 2 doses. Some of you may have received them. The Johnson & Johnson vaccine is 1 dose, and that's what we call a viral vector vaccine. Viral vector vaccines have actually been studied and made since the 1970s. And for the mRNA vaccines, they've been studying those and exploring those and making those vaccines actually since the early 2000s. So when people say this is actually brand new, that's not true at all. Next slide, please. Okay, some other things that come up quite often from men and women is that if they get the COVID-19 vaccines, that it's going to affect their fertility. And there's no evidence to suggest that there's any effect on fertility. The American College of Obstetricians and Gynecologists have also said there's no evidence to suggest that there's any effect on fertility. And also the national organization, I'll put the actual organization in their link in the chat, but it's like the American Society for like Reproductive Medicine. They have also said that there's actually no evidence to suggest that this will affect fertility for men or for women. And for many of you who have tried to have children or are currently trying to have children, it's very important for you to be as healthy as possible. So it's very important. Actually, vaccines are a good way to stay healthy while you're pregnant or while you're trying to get pregnant. It's also for pregnant women and women who are breastfeeding. There's no evidence to suggest that the vaccine should be withheld from anyone who is pregnant or breastfeeding. Again, the American College of Obstetricians and Gynecologists have statements basically saying that if women are considering the COVID-19 vaccines and they have concerns, that they should talk to their healthcare teams, but there's no reason that the vaccine should be withheld or that there's any evidence or concern to date that the vaccines would adversely affect women or their children during pregnancy. Some people also want to know, were people with a lot of different underlying health conditions included in the clinical trials? And the answer is yes. So there were people who had diabetes, there were people who had hypertension, there were people who were overweight, there were people who were obese. There were also people who were over 65, and a good breakdown of racial and ethnic diversity in each of the 3 major clinical trials for which we have available vaccines in the United States under emergency use authorization. And if you're interested, I can actually put a link. The CDC actually breaks down the racial and ethnic, gender and age diversity in the Johnson & Johnson, the Moderna and Pfizer trials, if you're interested. Some people have asked about, well, what if I have like an extreme allergic reaction to the vaccines? And maybe Dr. Ravenel can talk more later, but many people who have extreme allergies to vaccines typically know that in advance and often have a EpiPen on them. It is theoretically possible that you can have a major reaction to a vaccine that you've never had before. But the good news is that when you get vaccinated, you typically have to stay on site for at least 20 to 30 minutes to be monitored. And the vaccines are only administered by people who have clinical training in doing so. It's not just like someone off the street giving you a vaccine. So one of my very, very dear friends who is a lawyer called me when she was in Atlanta, and she was like, I want to get the vaccine, but I'm not sure if I can trust the pharmacist to give it to me. And I had to, let her know that pharmacists have real clinical training and they've been giving vaccines for many years. So I think the concern, the anxiety is really agnostic of your education level. I've had questions from lawyers and doctors and also friends of mine with other educational experiences. And then also there's concerns about what if I have a negative reaction or a bad side effect. Most of the side effects that have been reported so far, and just to remind everyone, we've now literally given millions of vaccines in the United States to people. And the most common side effects are tiredness for a couple days. Some people may experience a low-grade fever. Other people feel like soreness where at the injection site, but those are relatively minor, in my opinion, when you think about the side effects and the devastation of having actual COVID. Luckily, most of those minor reactions actually clear up within about a day or two. Some things that you can do in advance to help reduce some of those side effects is to make sure you're really hydrated when you get vaccinated. And also, like, especially if you're getting the mRNA shots, maybe like the next day after you get vaccinated, don't go run a marathon. Try to have a light day if you can. You don't want to go and, run like 5,000 miles. So just try to keep your next day or two light. And again, if you are hydrated really well, that some people have said that has helped. Next slide. Okay, so if you've been watching the news, there's been a lot of conversation, updates about masking. And so in May of just a couple months ago, around May 13th, the CDC actually relaxed some of its mask guidelines. And they said if people were fully vaccinated, and that means 2 weeks after you've either gotten your second dose of the mRNA vaccines or 2 weeks after getting the Johnson & Johnson vaccine, that largely in indoor settings, you won't need to wear a mask, but that you still should wear a mask in very congregated areas like on the subway, on planes, crowded parks, etc. I think the conversation is evolving in light of the Delta variant. So I don't believe that the CDC has formally updated its website quite yet, but many folks are suggesting that it's probably just a good idea, especially as the Delta variants and cases are going up. It's probably still a good idea to wear a mask when you're indoors around a lot of people. If you want to double mask, you do get an added layer of protection. So if you choose to double mask, it's best to you put your surgical mask on first, and then you would put the cloth mask over that. So the surgical mask goes first, and then you would put your cloth mask on top of that. And that's because some of the surgical masks sometimes are a little bit loose fitting, and the cloth mask gives you a little bit more of a snug fit, and that helps keep all your respiratory droplets inside. And should we be worried about the new variants? Yes, and that's all the reason why we should all be considering getting vaccinated if we're not vaccinated yet. The Delta variant is a lot more transmissible than prior variants, which means it can be passed to people a lot quicker, which means that more people can be infected in a shorter period of time because it's more contagious, it's more transmissible. So if you have not gotten vaccinated, I hope you consider getting vaccinated. The more people who remain unvaccinated, those are just more opportunities for these variants to change and mutate, and we might have other ones coming down the line. So I think we are all concerned, especially folks in the healthcare industry. So we should be concerned about it, but I also think we don't want to be fearful. We don't want to be anxious. We don't want to have these things paralyze us, but opportunities like this allow us to get information. It allows us to make sound choices, and it allows us opportunities to get support and kind of talk through what our concerns are. So I think we want to be empowered to make sound decisions based on good information. And I'm really excited and glad that I'm able to participate on this panel this evening. And I think, is there one more slide? Okay, so I don't know who's in charge of the poll, but it's not me.
I'll tag in. All right, so to those of you who are participants as well as our panelists, we are going to launch a poll. It is very short. It is 4 questions just to get your feel for the vaccine and your thoughts on COVID. You'll have about 2 minutes. And if you have any questions for Aisha or Dr. Pasaro, Dr. Boyce, feel free to insert them, and we will be sure to answer your questions when we get to them. There will be a brief Q&A session. Well, it won't be brief. We will have a Q&A session at the end of our webinar today. So we will give all of our panelists plenty of time to answer all of your questions. Myself and Ms. Fuentes will be monitoring the Q&A box and the chat box for any additional questions that you may have. If you are unable to submit due to any unanswered questions, I'd suggest putting other for the fourth option, and it should allow you to submit again. I'll give you all a couple more seconds. Most of you have already answered. Thank you for those who have responded. We're going to end the poll in about 15 seconds. All right. Thank you to those who answered. We're going to share the results. Give you all a few moments to review. So we see that most of you all who answered our poll have been vaccinated. We love to hear it. Many of you say that you would accept it per the recommendation of your doctor or healthcare provider. It's good to see that most of your friends and family have also gotten the vaccine. And we see that the main reason we have listed is other. But for the second and third most common responses for why people will not get the vaccine is they do not trust it or they have concerns about side effects. All right, so noting that, the final answer choice, if you did not have one and couldn't submit, had to be other. We take that into account. But we're now gonna have Dominic Boyce come back and introduce Dr. Joseph Ravenel, who's going to address some of you all's concerns according to your answer choices on the poll regarding the vaccine. And he's going to do an in-depth explanation on vaccines and vectors. I'm gonna let Dr. Boyce take it away.
Okay, once again, thank you. At this particular time, we're gonna hear from Dr. Ravenel, who once again is the Associate Dean for Diversity Affairs and Inclusion at NYU Health, Langone Health. And so we thank you. But before you come on, I just want to add 2 points. What we do know is that millions of unvaccinated Americans, adults, are vulnerable to hospitalization and death in this pandemic. Another thing we do know that if you're vaccinated, you're pretty much guaranteed not to be hospitalized or die from COVID. So those are the data, and the research is clear on that based on, federal data, city data, as well as state data. So those 2 things that we know for sure. And so I'm gonna turn it over to Dr. Ravenel now, who can, elaborate on those 2 points as well as others. Dr. Ravenel.
Thank you so much, Dr. Boyce, for the generous introduction, and to everyone who had a hand in me being here today. I'm really honored to be here. It's always a pleasure to follow my colleague, Dr. Langford, because she has done all of the heavy lifting and has done a brilliant job of explaining the COVID vaccines. And so it's a pleasure to follow her. As Dr. Boyce alluded to, we are definitely seeing the impact of the Delta variant most pronounced among those who are unvaccinated. I actually just saw a statistic from data in Texas that indicates that of the 9,000 deaths in Texas from COVID since February, 99.9% of those deaths have been among unvaccinated people. And so as we look at the Delta variant, which absolutely coincides with the rise in COVID-19 that we are seeing, and we believe that over 80% of the new COVID cases are the Delta variant. What I am seeing and hearing from my clinical colleagues is that the biggest impact is among those who are unvaccinated. Because we believe the Delta variant is more transmissible, people who are vaccinated can certainly get the Delta variant, but from what we're seeing, the overwhelming majority of people are not getting sick enough to be hospitalized. People, from what I've seen and from what I hear from my primary care colleagues, people have mild symptoms at best. The people who are being hospitalized and who are dying at this moment from COVID, and specifically from the Delta variant, are those people who are unvaccinated. And so our best defense is still vaccination, hands down, no contest. And if you recall, last summer, even before the vaccine was available, we had fairly low COVID infection rates, certainly compared to the spring of 2020. We really started to see things take off in the fall. And I really do believe that in those communities that have lower vaccination rates, that we're really going to see the disparity unmasked in a big way in the fall. When we look at the states that are being impacted the most from the rise in COVID in terms of death from COVID, it's in those southern states that have the lowest vaccination rates. So vaccination is so critical. So anything we can discuss on this call that will help anyone who's unvaccinated on the call to get vaccinated, but also to help you equip your family and friends who are unvaccinated with the information that they need to get vaccinated. That's what we really want to achieve on this call. So thank you all for being here.
And thank you, Dr. Ravenel. I want to piggyback on what you just said, because one of the questions from our audience, but also something that needs to be said, because you talked about certain communities that have low vaccination rates. Can you be clear what communities are you referring to? And the second part is, what are the comorbidities that are associated with the COVID pandemic, if you can speak to those?
So the community with the lowest vaccination rate is definitely the Black community. The African American population in the United States has the lowest vaccination rates. And when we look at New York specifically, when we look at, for instance, New York County, we see that the percentage of those who are fully vaccinated is close to 70%. But when we look at, for instance, Kings County or Bronx County, that have many more African Americans and Black Americans, we see that the vaccination rates are considerably lower, between 30 and 45%. And so, I think that's something that we really need to pay attention to, again, as I alluded to, as we start to see the seasonality of COVID really, come into effect, with the fall being the time when we expect for an even bigger uptick in cases. And can you remind me of the second question?
Well, the second question, I wanted you to identify comorbidities or chronic illnesses that disproportionately affect people who have COVID. Because one of the questions specifically talked about individuals with compromised immune systems. How are they impacted by COVID, particularly those who have organ transplants?
Great question. So for people with compromised immune systems, and specifically those people who are transplant patients, we know that those people absolutely have a higher risk of negative outcomes due to COVID, specifically death. And we believe that the vaccine, because it is not a live virus, that it is safe for transplant patients to take. As with any condition, you should definitely double check with your doctor if you do have a chronic condition such as an organ transplant. But we do believe that that all of the currently approved vaccines are safe for transplant patients. Some of the other comorbidities that are that put people at a higher risk of doing poorly from COVID, things like cancer, things like end-stage kidney disease in those who are on dialysis, certain types of heart disease. Early on, we believed that high blood pressure in and of itself was a significant risk factor. What we now know is that it really is those people who have uncontrolled and untreated high blood pressure and complications of high blood pressure who are at much higher risk. For those people who have high blood pressure, but it's well controlled on medication, we don't believe that those people are at significantly increased risk. So I hope that answers the question.
Also, Dr. Ravenel, is there a link between diabetes and obesity and COVID, and those who get COVID?
So yes, we certainly do see that those who are obese, and particularly early on, before we knew how to manage COVID as effectively as we do now, we definitely saw that obesity, and specifically morbid obesity, that is those people with a body mass index greater than 35, that those people were definitely at higher risk of complications such as being admitted to an intensive care unit or death. Diabetes definitely does have an increased risk, but similar to hypertension, for those people who have well-controlled diabetes, they probably bear some increased risk, but certainly not as much as those who have uncontrolled diabetes, and certainly those who have complications such as end-stage kidney disease from diabetes. But for those groups who have those chronic conditions, I would absolutely not hesitate and say you need to be vaccinated, point blank.
Thank you. And I'm going to pivot to Dr. Langford, and you can chime in too, Dr. Ravenel. One of the concerns, particularly around vaccine hesitancy, obviously by the poll, one of the answers where there was an issue with trust. And that's a historic issue that Dr. Langford, you can talk about. But the other piece related to the actual medical or clinical side is that regarding the vaccines, many people have concern relating to the quote unquote heart effects, side effects that have been reported in some journals. So can you speak to those two issues?
Sure. So I think the trust is a very layered issue. So I think some people have mistrust of the medical establishment for years of mistreatment and how Black adults and children have been handled, and in many cases not fully respected and given proper care at medical institutions. So for many people, that's a concern. I've heard even some of my own colleagues or community health workers say, well, why now? Why is everybody so concerned about the underserved now, when all these years people haven't had health insurance, they've had diabetes, they've had hypertension, we've been needing like vaccinations for other things. And now all of a sudden, because now the whole world is affected, now everyone cares about Black and brown people and all this stuff. So I get that. I do think issues like the Tuskegee syphilis study come up quite a bit. I do think many people know about that, but I think for a lot of folks, You don't have to go back 50, 60, 70 years. A lot of people have their own experiences in recent times with a healthcare interaction. So I totally understand those concerns. And then also, I also like to say that these clinical trials are some of the largest clinical trials we've ever had, like literally in medical history. So the COVID-19 trials have had over 100,000 people in them. I've been one of the people who've participated. But when you think about things that we take every day, well, you may not take, you probably don't take an aspirin every day, but sometimes people take aspirin, you may take cough syrup, you may be wearing contact lenses. So the COVID-19 trials are literally some of the biggest trials we've had in the history ever. And that makes me very positive about taking them. They're also many of the large professional organizations, including the National Medical Association, which is the largest professional organization of Black doctors, several nursing organizations, social work organizations are all really behind the vaccines, and they all understand, they all get it, that, you know, our history in health has not been perfect, but they also understand that large people who look like you and me are dying in mass, and they would like it to stop. And so I think two things can be true at the same time, that we've had a complicated history in medicine, and today many people are suffering, and vaccines are one way to help put a pause and really stop some of this suffering and transmission. So it's complicated, but I think it's really important for us to have a really well-rounded conversation about all these things.
And again, some people are scared or they have hesitancy around the vaccine because of the reported heart side effects.
Oh yes, I'm sorry. So Dr. Ravenel, well, I'll just give a first pass. The side effects. So there's myocarditis. So there have been some reports of that. I think in the grand scheme of things, that's still very rare. And I think to just put this in context, when people have actual COVID-19, some people have what they call long COVID. And once you have COVID-19, in some people, you have even greater risk of getting blood clots, neurological issues, heart things. So really it's at the heart issues and the heart conditions, the neurological things, that's like literally your brain, your circulation, all of these things. Potential side effects are a lot worse if you actually get COVID. But I'll turn it over to Dr. Ravenel. Just to put it, let's get some context here of what we're really talking about.
Dr. Langford is absolutely right. I could not have said it any better. We believe that the risk of myocarditis, which is the major side effect from the major heart side effect from the vaccine, is exceedingly rare. It's about 5 people per million. So if we were to line up 1 million people, 5 of those people would get myocarditis and they would not die from it. Myocarditis can happen with really any vaccine. And basically it's inflammation of the heart muscle. And it is a risk with any vaccine. Many of you have probably experienced myocarditis as part of a cold. And so it generally is not a serious side effect. And when it does happen, again, 5 people per million. Dr. Langford is absolutely right that your risk of having a heart attack, a stroke, of having blood clots, and of dying are just orders of magnitude higher if you get COVID. And so there's no reason at all for anyone to be more afraid of the vaccine than of the disease itself. The disease, just to remind people of where we were this time last year or a little bit earlier. In May of 2020, 8,000 people were dying per week in New York City. That's over 1,000 people per day dying from COVID. 1,000 people per day dying from the disease. I mean, we can't even dream of approaching anywhere near that with the vaccine. So when we look at vaccine safety, the risk of having a serious allergic reaction is about 2 to 3 per million. So you line up 1 million people, give each and every one of them the vaccine. 2 of them will have a serious what we call anaphylactic reaction, and they will almost certainly not die from it. Again, I really appreciate Dr. Langford putting it into context. The disease is far more deadly and far scarier than the vaccine. And really, I think when we do see the myocarditis, it happens more often in younger people. I'm proud to report that I have, I'm proud to report that I have 4 children, but that's not something that I should brag about per se. But I'm proud to report that I have a 14-year-old and a 12-year-old. My 14-year-old is fully vaccinated. And my 12-year-old, we went to get her second shot yesterday. I just saw her a few minutes ago. She's doing great. So I know that many people are concerned about whether or not to vaccinate their children. I believe, I can only tell you what I would do. And I have already vaccinated both of my children who are old enough to do so. So that's my 2 cents.
And I would second that. I have 2 sons. Actually, my 14-year was the first kid in the health and hospital system to get vaccinated. And, it's important. And so that, not only for safety reason, but for modeling for our community, because we need to see, the communities where the vaccine is really running rampant. Those are communities that need to be protected. And so they need to see individuals like myself and those on the call who are influencers who have, I believe, some credibility to come and educate and become aware. And so this is why it's important to, be involved in the community, working grassroots with churches and organizations, civic organizations like the NAACP, which has been spearheading a lot of issues around health equity, during this pandemic. But I've also run across friends and family members say, well, I'm already in my 40s, I'm already in my 50s, I get the vaccine, something happened to me, but they're still hesitant to get their kid vaccinated. And so the more us they see in their community, in their networking, getting their children vaccinated, the more they're likely to come around. And I see it happen all the time, even with couples, if you get the wife to get vaccinated, sooner or later, the husband's gonna come around. So that's an important piece. And Dr. Langford, this whole thing about social determinants of health and everything, can you speak about that in this light?
Oh, wow. Okay, so I will say I am very glad that there's been one just conversation about what the social determinants of health are, especially during the pandemic. I mean, they've always been an issue, but it's broadly the idea that where you live, where you work, where you play really impact all aspects of health. So your housing, your education, access to healthcare, whether or not you have health insurance. And even if you do have health insurance, can you go to a place that provides high quality care? And so it's part of the reason because of social determinants of health that does impact people who were actually exposed. So you think about professions and occupations, more people that were brown and Black were in essential roles. So they may be working in public transportation or in grocery stores, et cetera. So by nature of your job, they didn't really have as much privilege as maybe someone like me who could work from home, right? You can't do groceries, you can't do caretaking for someone else if you're like a certified nursing assistant from afar. So that really played a role. Also, broadly speaking, people were very concerned about early on if they were going to be charged to get the vaccines, because a lot of people don't have health insurance. So they thought they might get a big bill. Again, that's another social determinant of health. Do you actually have health insurance? And if you do have health insurance, do you actually have an active doctor or primary care provider? And is where you get your care convenient and high quality? So all of those things are really coming to light. They've always been issues. They weren't an issue just a year ago or 2 years ago, but I think I'm hoping that we will really talk about in a very real way how the social vulnerabilities really impact various populations, but we're also connected. I mean, if nothing else, COVID showed us, if your neighbor across the street who's delivering your groceries, or the person who works at the pharmacy, if they're not protected, if they don't have what they need, you can be infected. There's no we can't just go on an island and be by ourselves. We're all very, very connected. And I think the COVID-19 pandemic humbled a lot of us in many ways, and reminded us that we're all very connected. And it's really in all of our best interests to really advocate and make sure that people, have the conditions, the social conditions that they need to be well. Because if parts of our society, we saw with the economic shutdowns, if we keep opening, closing, schools opening and closing, everyone's going to be affected. So those are just a few things. I know Dr. Ravenel has done some papers on impacts of social determinants on a variety of things, including COVID, but I don't know if you have any other thoughts.
I really don't have anything to add to that wonderful explanation of social determinants of health. I did want to add, I did want to address a couple questions I saw in the chat about the vaccine for people who've already had COVID. And I also want to back up a little bit and apologize for a poor choice of words when I said there's no reason to be more afraid of the vaccine than of the disease. You don't need a reason to be afraid. Our job here is to equip you with whatever information we can to help address those fears. We recommend that even those people who have had natural COVID infection, we still recommend that those people get vaccinated as well. As you may or may not know, you actually can get COVID again, even if you've had it once. And I actually have seen it. I have seen it personally, among friends and neighbors. And so we believe that the vaccine actually protects you from it reduces your risk of getting reinfected. And even if you were to be reinfected, the vaccine would actually protect you from having a severe course in that reinfection. You should definitely talk to your doctor about how long after you've had COVID to get vaccinated. But we believe that if you get the vaccine 4 weeks or so after you are asymptomatic, we have seen that to be a very safe way. I just wanted to address that question, and thank you for asking it.
As a follow-up, for those who have been vaccinated, how long is the vaccine good for? There's been talk of a booster shot, but there's a lot of, uncertainty about how long the antibodies and the vaccine is effective for. Can you speak to that? Because that's on a lot of people's mind as well.
Yeah, that was actually in the Q&A box. So I actually got an optional booster shot through the clinical trial that I'm participating in. So it's not publicly available. I'm in a phase 1 trial, which again is first in humans. And I guess it's kind of cool. We are literally kind of informing the science by doing it. So I chose to get the optional booster shot in March, but it's not publicly available. And I actually had a vaccine clinical trial follow-up visit last week. And every time I go, they take blood. What they're doing is really seeing the durability of the vaccines, what my antibody levels are in people like me in the study. So the short answer is, I think there's been a lot of talks of booster shots. I don't think right now, as of today, booster shots are not recommended. I think that probably will be on the horizon and sometime in the future, but it's not recommended as of today. So literally, we're still learning from all of the clinical trial data and the people that are still participants. I joined the clinical trial in July of 2020, and they're following me and several other thousands of people for about 2 years. So the information is cumulative. Someone else asked about why is the CDC collecting data around who's vaccinated and who's not. Part of that is because it's really important to have public health surveillance. And many people early on were advocating that it's really important to collect data, one, just so we know kind of what's happening around the country. But many people were saying that the CDC, you should be collecting racial and ethnic data, where people are living, geography, age information, because that will inform health policies and actually where you have distribution centers and additional support. So a lot of times that data is actually reported in aggregate. So it's unlikely that someone could say, oh, Susie Q, who lives on, Broadway Street in apartment number 3, got the Pfizer vaccine. But I think it's the big picture is it's really important for public health surveillance and to understand what additional resources are needed and where. And I'm sorry, I think it's Kadia, or I don't know if I'm saying your name wrong. Kadia had a really great question about when the polio vaccine first came out. There was a lot of vaccine hesitancy, and I was not alive then, but I don't know if any of you all saw that picture of Elvis, but they were saying people are afraid. They're not listening to public health professionals or doctors, but they really liked Elvis. So literally Elvis went on the Ed Sullivan show, and right before his show, he actually got the polio shot on like national TV, and a lot of people that really prompted them. Now, I don't know who our modern day Elvis is. I don't know if that's Beyonce or whoever, but I do think that anytime something is new, it's quite natural for people to be anxious and scared. And we have conversations like this, and people get more information, they get more comfortable, people in their social circles get vaccinated. And there's always going to be a group of people maybe who are vaccine hesitant or maybe true anti-vaxxers. But I think the majority of people really care about their own health. They care about their family's health, and they care about their community's health. And when we give them the support that they need, and when we listen and not judge people, I think most people are open to changing their mind. So I'm very optimistic.
So just quickly, we're going to go to the speed round with the questions as time
Sorry.
Close. No, that's fine. You've done excellent. Quickly to Dr. Ravenel, why, given the amount of time that the vaccine has been out, why hasn't at this particular point the FDA fully approved the vaccines? And also, would that help in terms of increasing the vaccination rate if they came out and said, oh, everything is fully approved at this point?
That is a phenomenal question, Dr. Boyce, that I actually do not know the answer to. So I don't know the answer to the first question of why the FDA has not taken away the emergency use authorization and just given it permanent approval. I do believe that they're just it's out of an abundance of caution that they are doing so, and I respect that greatly. But to the question of whether or not it would increase vaccination rates, I honestly don't believe so. I think what it will do is it will actually give employers the ability to make it mandatory, which will actually result in, I think, an increased vaccination. Yes, I think that it will be that when it receives, when the emergency use authorization is taken away and it's given permanent approval, it certainly won't increase people's voluntary willingness to take it, but I do believe that in order for people to stay employed and to take care of their families, they will decide to get vaccinated.
Next, I'm sorry. Next quick question, speed question. There's been a lot of conflicting information. One, the CDC says you don't have to, at some point earlier this year, a couple months ago, they said, those who are fully vaccinated don't have to wear a mask together with other people any longer and everything like that too. But then they deferred to what's happening basically on the ground at the localities where you're located at. And so can you speak to that in terms of what is your recommendation, Dr. Ravenel, Dr. Langford, in terms of what should we do, given that we're here in New York City? What is your best recommendation that you can give to those on a call and to those who live in New York City?
Yeah, so quickly, my best advice is So generally for outdoor settings, we do believe that those settings are fairly safe, particularly for people who are vaccinated. Even if you are outside and you come into contact with someone who is unvaccinated, your risk of having a clinically significant infection is actually very low. And particularly with the Delta variant, it's really indoor settings where we are most concerned, and that's what the data from the CDC are telling us. I went into Costco the other day, and I basically, after a couple of times of going without my mask, I actually have started to put my mask back on because of the Delta variant. Am I worried about severe illness from the Delta variant? No, but I just don't like being sick, and so I would prefer to avoid avoid COVID altogether. And so I have started to put my mask on going into public places where social distancing is not possible. I think the MTA, the MTA's recommendation to wear masks on public transit, I absolutely recommend that people do that. And in any other indoor setting where social distancing is not possible.
Quickly, Dr. Langford.
I agree. I was on the subway today and I was in Macy's today, and I had my mask on in both places. So the only time I would feel comfortable being unmasked indoors is if it's with people I know, which it's not a whole lot of people I'm indoors with. Other than that, I don't really trust the honor system or that people are going to do the right thing all the time. So I have my mask on when I'm in public spaces. Outside is good. It's good to get fresh air and sunshine. Outside generally is very low risk for vaccinated and even unvaccinated people if it's not a crowded space. So it's good to be outside.
And my last question, and then I'll defer to Ms. Johnson as we about to end the call. But first of all, we talked about influencers, and I wanted to hear from the panelists in terms of, we hear a lot from the President Biden as well as those in the political realm, but in terms of vaccine influencers, who would you recommend, or what strategy would you recommend going forward to those who are on this call to utilize?
Yeah, so I think all of us on the call who are vaccinated, we should look at ourselves as influencers of those in our circles. More broadly, certainly community leaders like pastors, barbers. And we don't have Elvis, but we have Juvenile and Vax That Thing Up. So, and so the more we can have those social media influencers, get into this business of promoting the vaccine, I think the better. So,
okay, Dr. Langford.
I totally agree. And the Vax That Thing Up I was jamming to that. And I will say, I listen to like Dr. Fauci and like the American Medical Association, but most people don't. And I remember about 3 or 4 months ago, my mom wanted me to do like a little Zoom with her friends from church. And I was like, Mom, like, I'm going to just basically say what Dr. Fauci's saying. TD Jakes did a thing, Tyler Perry. And she's like, well, we don't know those people. And we don't know if they got paid, but they're like, we know you. And we know that you care about us. And so I would totally echo what Dr. Ravenel said. Don't underestimate your ability to really be an influencer with your family and friends, because they know you, they know that you care about them, they know that you love them. And I think that carries a lot more weight than like some random person that they see on TV. Although the Juvenile video was the jam. I loved that. It was so good.
I think I'll give my answer, because my answer actually leads into the closing remarks. So my training, I am by training a research scientist, and my work focuses on minority health disparities or issues within minority health. I sit on the National COVID Task Force, and a lot of my job is advocating on behalf of families and giving researchers and clinicians like myself and people who don't look like me I'm giving them the reasons as to why members of my community don't feel comfortable. You know, although I, as a scientist who has been vaccinated and was one of the first people on board getting that on the vaccine train, I even still had my own, concerns. And we are now in the point where the people who are wait and seers are still sort of they've either gotten vaccinated or they're very at the standstill, and there's a lot of misinformation that is being shared out in the world, and it's causing a lot of fear. And I have to stand in the gap and say, well, families have concerns because of these reasons. Now, I do stand in the gap, yes, professionally, but when I'm standing in front of these people, I make sure to be kind, and I try not to badger. A lot of times you can add to the mistrust if you are being forceful, and doing things with a hard hand. And something that one of the clinicians from the Morehouse School of Medicine in Atlanta said was, we have to encourage the power of a slow yes. Give people the information that they need. Hand holding is really what's doing it, being there in an intimate way with families and friends that allows them to get the information, not feel badgered, not feel pressured, but be informed. So I say this in going into my closing remarks, which are, if you see anything, to those of you who are watching, that may spark some fear or may raise a red flag in regards to the vaccine, we say go out and look at the information that's being presented by credible sources, right? So as been shared throughout today's talk, you've seen many a link in the chat box to information provided from the National Institute of Health, the CDC, and as well as the World Health Organization. So if you see something, as mentioned by Dr. Ravenel, in regards to how many people experience a side effect, what does a side effect actually entail? If you see buzzwords, like cardiomyopathy, research it, use credible sources, come to an understanding of what it is that you're seeing, and then taking that information and using it to make a decision, not informed by fear or misinformation, but by your own intellect, by you taking the time to figure out what is best for me, what works best for my family. And we hope that you can then make a better or more informed decision. Now, do I have concerns? Not in regards to the vaccine, no. I'm more concerned about my fellow man. As Dr. Langford said, some people are not using the trust system accordingly. So we hope that, if you see something and it comes from a .com, research it on an edu, on a org, on a .gov, and take, the resources that are at hand that have been created by people like myself, Dr. Langford, Dr. Ravenel, and so many other scientists and many scientists of color who stand in the gap and who are here and, share some of your concerns, but are doing the things necessary to protect themselves and their communities. So with that, we want to say thank you to everyone involved today. Thank you all for joining us. We thank you so much for your time and participation. Feel free to use the links that have been provided in the chat box. And we also want to provide a special thanks to everyone at MCNY, everyone at NYU Langone, as well as Dr. Marilyn Fraser from the Arthur Ashe Institute of Urban Health, who kindly brought all of us together today. So we thank you all so much again for joining us, and we hope you have a great day. We hope you would consider getting vaccinated if you haven't, and we hope that you share this information that you've been provided with today and share it with your friends and family. Thank you all.
Thank you so much.
Thank you.